Welcome back into News at 4. Technology is always advancing, so why not use it to help when we can? Dr. Matthew Fourman is a surgeon with ProMedica and is here to talk about how they're using upgraded robots during surgeries. Thanks for joining us.
Thanks for having me.
So we were just talking a little bit. We've already been using robots in surgeries, right?
Correct. They've been around for 15 or 20 years now in mainstream. The technology's been there for a while, but they've really been used more mainstream for the last 10 or 15 years, correct.
And what is different about these particular, you guys have 3 new robots. What is different about these robots?
So ProMedica just made a significant investment to advance the technology and upgrade the robotic program that we already had that was very successful. And really the changes are more to the technology themselves. So as a surgeon, there's some features on the new robots that are unique and different, but really it all translates to allowing me to do better surgery for patients. An example is now when I'm using the robot, I can actually feel tension on tissue and things like that. And so it's recreating more kind of real feel, some visual aids that help me be more precise. So a lot of it is just technology based to help us have better patient outcomes.
Sounds more sensitive, maybe.
100%, absolutely,
okay.
Yes.
And what kind of a patient would apply for, and you're looking at some video of these robots right now, what kind of patient or surgery could take advantage of these robots?
Yeah, so the beauty of this particular system is it's applicable to a really wide variety of cases. We have over 40 surgeons in ProMedica now that do robotic surgery, and really it's across just about every specialty, general surgery, OBGYN, trauma even sometimes, cardiothoracic. So it really has a wide application.
Would a patient know, or can they say, I prefer that you use this type of robot versus this type of thing, or is it just something that you guys as surgeons decide there in the operating room or before the case?
So it's never right before the case. At least for me, it's always a dialogue that I have with patients. Just about all the surgeries that I do are done robotically, but certainly there's still some surgeries that do not amend themselves to the robot. But it's a conversation that we have with the patients so that the patients are well informed on what their surgery is all about. And I will say, some patients, there's a kind of a knowledge gap. So when I say I'm doing robotic surgery, they have images of a robot doing the surgery.
And you're just sitting back.
Right, correct. And so it's really important that they understand that I'm still the one doing the surgery. It's simply a tool that I use to accomplish my goal. And it actually allows me to enhance my abilities as a surgeon. So by no means is the robot doing the surgery. It's just assisting me.
Right. And the recovery with some of these robotic surgeries can be a lot quicker.
Absolutely.
Scarring can be a lot less severe, right? Correct.
So most surgeries are done, if they're completely robotic, the incisions are an inch or less. It's allowed us to do surgeries now that people used to be in the hospital for 2 or 3 nights and are now even going home the same day. So the hospital stay as well as the return to work has dramatically improved in favor of the patients.
Yeah, absolutely. You guys are also a teaching hospital. You wanted to talk a little bit about how you're training future doctors to work with this type of technology.
Yeah, absolutely. So we train resident surgeons and physicians. We train fellows. We also train surgeons from across the country that come in and learn how to do robotic surgery. So it provides a really unique opportunity because the other surgeons can actually sit in the console and see what we're seeing. And so it's a really valuable teaching tool as well. Absolutely.
Absolutely, doing great things here to train the next generation of physicians here in Toledo. Dr. Matthew Fourman, thanks so much.
Thanks for having me.
ProMedica.